I don't think of myself as a revolutionary person. It's just that as I think about things, I just start doing them quietly, and then something happens. I usually say I'm Wisconsin bred, born, and educated, okay? I was born in Racine and delivered by a midwife at home. My father was born in Naples, and my mother was born in Amsterdam, so that's quite a mix. My dad's family was among the poorest in Racine. We didn't realize that we didn't have much money, but I don't think we had much money. But we had lots of other things, which we had family, which was very important. I have to recognize my mother. We have very strong women in our family. She didn't see any reason really why we couldn't do what we wanted to do. In ninth grade, when you have to write the story about what you think you'd like to be, I wrote one about the first woman doctor, because that's sort of what I wanted to do. We went up to Marquette to see if I could go into the nursing school there, but it was too costly. So I went to St. Luke's, a 3-year nursing school in Racine. Then I decided to come up and make an appointment with the dean here, Dean Middleton. And I was kind of shaking in my shoes, to say the least. Most of the schools had a number of women and minorities that they would take. There were 6 of us in my class, and I think there were 58 total. Did I feel any discrimination? I can't say that I did. It may have been there, but I maybe didn't notice it. We had to do an internship before we went into specialty training. I wanted to go to the Cleveland Metropolitan, which was a county hospital then. Most of the patients coming in there were minorities and African American, as a matter of fact. There were women who didn't want their pregnancies, and they used to put something like bichloride of mercury tablets in their vagina and thinking that would cause them to have an abortion. Seeing women that desperate that they'd do something to themselves is what always comes to mind. It came time when you had to make a decision, and so I decided to go into OBGYN and then to come back to University of Wisconsin. Ben Peckham had one spot left and he wanted me to come, so I came. And when I came, he said, "Gloria, I'm going to treat you just like one of the boys." And I said to him, "If you do that, everything will be fine." My parents sort of wanted me to go into private practice in Racine because their daughter was the doctor. In some ways, I think they were a bit disappointed initially. We had small practices as residents that were our own individual. It wasn't a big clinic. They took care of women on campus and also graduate students, so they were sort of our patients. I was an instructor in the medical school when I started working on my PhD. Working with a pediatrician who was looking at Turner syndrome. which is a condition which women have just one X chromosome, and so the ovaries do not develop. And at one time, they thought that they would get tumors. So if I was going to be operating on females that had Turner syndrome, that perhaps I ought to learn about it. When I finished my PhD, I applied for a grant to get my own research laboratory going. What came out of all of this was my starting to work with amniocentesis. It took a while because we didn't do amniocentesis as early as we would have to do it to get the cells to grow. And so I started doing that, and it was successful. I did the amniocentesis, I grew the cells, did the diagnosis, and then took care of the patient depending upon what she needed. A lot of things were happening on our campus in the early 70s. There was a big movement. Well, when Lamaze first started, there was a big hoopla by obstetrician gynecologists thinking, who are these people that are going to teach women how to go through labor? I guess having been a nurse in labor and delivery, I realized the importance of coaching. When all the hoopla was going on, we were meeting in the basement of the university hospitals. When the Roe v. Wade came, from the point of view of an obstetrician gynecologist, it was a relief. We would hopefully no longer see young women coming back to our emergency room on a Sunday infected or having hemorrhaging from an abortion that was done elsewhere. And then when I think back of those women when I was interning, it all comes together. In '76 then, I went to Northwestern. I went down as vice chair and also as co-clinical director of the Prentice Women's Hospital. The women that we took care of at Prentice in our clinic, they couldn't get in somewhere for care. I mean, we were giving prenatal care, but they couldn't all get in for the prenatal care classes. And so we had to do something. I thought, well, if we had some way to take books and some way to teach to what was then the Cabrini Green area. I went with this administrator. I think we went to 2 banks, and we got enough money to buy a bus. And the back part of the bus was like a little classroom, and the front part of the bus had a lot of educational materials. And we had women come in, and they did their educational piece. After they finished that, then what I would do is bring them into Prentice Women's Hospital. We'd have a little ceremony, and I would give them certificates that they had completed their prenatal classes. Taking it out to the community is what I thought would be important, and it worked. Bob Wilson was at New Mexico. He was sort of an emeritus person down there. And at a meeting, he said to me, Gloria, would you think you'd like to look at a chair at the University of New Mexico? What was nice about University of New Mexico is the population in Albuquerque was about 30% Hispanic and 10% Native population. So there was a mix there. Florence Hasseltine noticed that at the NIH there is very little research and women's health. We knew that once that hit the newspapers, it would be off and running, and that's what happened. People had to realize that research done in men cannot just be automatically transferred to women. It really takes policy changes that are always hard to do, environmental changes, getting food deserts taken care of so people have a place to shop, segregation, discrimination, all of these things affect the health of various populations. Vivian Pinn was trying to put together a research agenda for the 21st century. What I had for that was looking at health disparities in women's health. It helped to have Bernadine Healy, who was the first woman to head up the NIH. It was coming because I'd seen it at Cleveland. I saw it in Chicago. You know, and maybe coming from the childhood I had, which we didn't have a lot of money, I had some empathy for that. And so that's where a lot of that started. While we were in New Mexico, my partner, Lisa, and I adopted 4 girls. And I thought, well, I'd come back maybe to do a sabbatical in Madison, looking at health economics and how it affects women's health. I became aware of the Black infant mortality rate in Wisconsin, the highest in the country. And so I said, really, we ought to do something about that. And that's what made me really start looking at health disparities and health equity. A lot of people weren't even aware of it, even some of our legislators. When I was in the Center for Women's Health Research, that's when I started thinking I'm going to write this grant for health disparities research.
Health equity is a broad topic, but certainly in women's health in the state of Wisconsin, it's impossible not to be struck by the fact that Wisconsin has the highest African-American infant mortality rate in the country. Dr. Sarto has and continues to play a vital role in investigating and assessing why that is so, and thinking about ways in which we can improve that. Women do carry a lot of the burden in many aspects in terms of health care in this country. 70% of adults on Medicaid are women. And then the data regarding the number of women that live below the poverty level, that are single parents, it points to the fact that health care directed specifically at women would serve us well. To really take the research from the bench to the bedside to the community, one must have a community network. Not just in clinical care, but in teaching and in research. It's not just the science behind what we do. It's going to be very important to continue to grow those relationships.
About how we can integrate clinical medicine and public health.
We're going to have to train people to do some of this research, and I think that's why I speak to the Health Disparities Research Scholars Program, and what they're learning to do is health equity and health disparities research. The training part of it and education is really important across the board.
It's my view in life you can do a lot of talking, but in the end you gotta get stuff done.
Committing department resources to establishing a Center of Women's Health and Health Equity in association with establishing the Gloria Sarto Endowed Chair in Health Equity is so important to women's health. And I think extremely important for this department and for this University of Wisconsin.
Hey, Gloria.
We have the guru of the world in the Department of Obstetrics and Gynecology at the University of Wisconsin. I can't think of a better way for this evolutionary process in the department. the most important resource is actually the people. So recruiting and retaining the very best physicians and PhDs is critically important.
I kind of think of this as handing the baton to the next person and taking it from here to where it has to go.